Hello, my name is John Baston. I'll be the moderator for today's webinar on how states can activate and share data to improve whole person care. State Medicaid programs are increasingly taking advantage of federal rules that empower them with flexibility to pilot innovative approaches to care delivery. And one of those shifts is towards whole person care. It's based on the realization that if you want to create opportunities for people to truly live a healthy life, then the access to food, a stable home, transportation, to doctor's appointments, et cetera, are things that many of us take for granted. Doing this successfully requires sharing data. And unfortunately, sharing data in state agencies has been difficult. Those challenges don't come from a lack of desire, as we know, but often from a traditional approaches to data warehousing and data sharing that simply weren't built to handle the variety nor the volume of data that's needed in today's organizations. Technology is no longer that blocker. The leaders on this panel are going to discuss the huge advances that are being made in cloud data sharing, changes that enable us to take data in ways that minimize the tough task of data movement and maximize access to data needed for whole person care. During the webinar, we invite all viewers to ask questions. We'd like all attendees to please submit them through the Q&A button, as the chat will be disabled during this time. If the panelists do not get a chance to answer their questions live, we'll make sure that those questions are answered through our team, responding back by email. As always, we encourage you to explore and learn more about Snowflake, as well as Innovacer's data activation platform in the Snowflake marketplace. Those links will be shared with you in the show notes listed with the webinar. So without further delay, I'm excited to introduce today's panel. So with me, we have Matthew Rose, Principal Global Public Sector from Snowflake, Mike Sutton, Chief Technology Officer with Innovacer, and Brandon Grafey, Senior Director with Innovacer Public Sector. It's great to have you all here, gentlemen. And before we get started, I'd just like to ask each of you to share a bit about yourselves and your journey in healthcare with our viewers. Matthew, you want to go first?
Yeah, thank you so much, John. Thanks for the team for having me today. So as you have mentioned, my name is Matthew Rose. I'm here with Global Public Sector at Snowflake. As part of the team here, we're really the team that's bringing Snowflake to the education public sector and the government public sector, which includes healthcare as well. I'm calling in from Toronto, visiting the team up here. Just did a discussion with several of the folks up here as it relates to improving the patient experience as it improves the systems and the business of delivering healthcare. I've got 20 years of experience in the field and look forward to speaking with the entire audience today and each of you on this important topic.
Great, thanks, Matthew. Mike.
Yeah, hi everybody. Mike Sutton. I'm the like John mentioned, I'm the Chief Technology Officer at Innovacer. Unlike Matt, I'm not a career healthcare person. However, I before joining Innovacer, I worked for Kaiser Permanente. I joined Kaiser Permanente for 6 years as their Chief Technology Officer, and helped them modernize their data platform, which bringing in the cloud, bringing in capabilities like Snowflake. And then managing, the data platform to help better serve their patients and their clinicians for the Kaiser Permanente customers. But prior to that, I've been involved in modernization of the data environments. And I worked for the Central Intelligence Agency. I was a deputy CIO there, helped them move their environments. I was in the cruise industry when the Open Travel Alliance happened, how to make data available in that particular space. And then I spent time in the oil and gas business during the consolidations in the 90s. And all of which, the pattern that's been happening is that technology is just enabling us to do things that we've been trying to do really for decades. And now we can certainly talk about where we are today. But it's great to be on this panel with you all.
Good to have you, Mike. Brandon?
And I always hate following Mike because I don't have anything as cool as having served in the CIA on my resume. But as John said, Brandon Grafey, Senior Director for the Public Sector here at Innovacer. My career has really been both in government and private sector, sitting at this intersection of policy and technology, really helping government agencies figure out how to leverage technology and all of the awesome data assets that they have to really solve some sticky problems, including the one we're talking about here today with whole person care. Had the good fortune of being of working with the state of North Carolina on several key policy and legislative initiatives, including the Health Information Exchange, a government data analytics center, which really promoted cross-departmental data sharing, as well as the shift from fee-for-service to managed care, which also has sort of roots in being able to better share data amongst all of the different stakeholders in Medicaid. So excited to be a part of the panel and look forward to the discussion.
Great. Thanks for everybody's introduction. Happy to have you here. So let me just go over a couple of ground rules. This is a 60-minute webinar approximately. We're going to have about 10 minutes dedicated towards the end for Q&A. But again, please put your Q&A into the sessions. Use your Q&A button as we go forward. In case you have any questions while the discussion is taking place, we can do that. We have the agenda on the screen. You can read that: creating a data-driven culture, enabling seamless data sharing, fostering whole person care, and creating an integrated data ecosystem. If there's other topics you'd like to cover please use your Q&A button to go forward with that. So without any further ado, let's get started. We'll start with you, Matthew. Why don't you give us an insider peek on what you're seeing amongst you're in Toronto, so obviously you're a global guy. Let's talk about what's going on globally with customers and what's top of mind.
Yeah, thanks. So you know what? One thing that's really coming front of mind to me, and I was speaking to some leaders in Ontario yesterday, is it's really time to revisit our assumptions as it relates to technology. Many of us have been doing this for several decades. Some of us are new, but what we're finding is that it's time. And you know, I'm also seeing this with Snowflake's own journey. What we've seen with the development of Snowflake from the platform over time is it really showing us is changes in the market. What we've seen over the past 25 years, if you think about the market, and it was highlighted in some of Mike's experiences, thinking about what was occurring. Energy was king, right? And then we quickly moved through the .com internet era. It's like we blew past the mobile and the cloud eras. But what I'm finding right now is we're entering truly within the data era. And as I look back in time, you know, I've never seen technology move so quickly before. And what's unique, perhaps, to the public sector is that the public sector, and I was telling this to others up here yesterday, is it is every industry, it is every sector. And I still have a challenge out to someone that perhaps in the audience can help is tell me something that happens in industry or another sector, and I could probably find out, and I've got a perfect average right now of who does it within government somewhere within the world. And that's unique to the public sector, and it's also invaluable. Because what you can see is early adopters, you can see pioneers incorporating new technologies, new methods, and the public sector can sit there and watch it and determine, what should we be doing. So that's what I'm seeing. That's what's front of mind. But as I speak with others, what I'm continuing seeing over and over as it relates to the data era is that data is core to operations, both front and back office. And one key area where I continue to see folks moving is it's cost. Cost is king. So the CFOs are remaining front of mind as it relates to changing operations. And it's really, that's where change is sometimes occurring within organizations. But what I find is that one of the key external reasons for folks moving, and as it relates to this audience today, it's the citizen experience, it's the expectations, or the patient experience and the patient expectations. So while organizations are making cost-informed decisions, they cannot ignore the needs, the wants, the desires, the expectations of those they serve.
Yeah, some great points there, Matthew. Yeah, government is definitely a microcosm of the entire society, as you said. Brandon, anything to add?
And I just reiterate Matthew's point, right? We're absolutely in the era of data. I think one of the things that ushered in that era, something that we're probably all really tired of talking about, is COVID, right? Especially in healthcare. It was a sea change that really forced states especially to think through how to share data between public health departments, Medicaid agencies, managed care organizations, and all the other stakeholders who are ultimately responsible for not just identifying outbreaks and promoting vaccination, but guiding folks towards health in this very uncertain time. That did not always go smoothly, right? I think it really highlighted a lot of the cracks that we have in data sharing while also highlighting the importance of data. So it sort of brought those two things together. We knew data was important. We recognize now that we don't have great ways to share it, and that gave us sort of a unified purpose of things that we can overcome. I think more recently, the expiration of the public health emergency and then the subsequent unwinding of continuous enrollment requirements is also forcing our hand in data sharing, right? Things like in Medicaid ex parte renewals require the state to kind of comb through a bunch of data to be able to determine eligibility. Even now, kind of creating these data sharing channels between states and managed care organizations to help them begin the renewal process, to help them update their contact information, and then if ultimately necessary to transition to other coverage. That all requires being able to seamlessly share data between states and in this case payers as well as members, which I think is another point that Matthew was really driving home, right? It's this ability to get all of these various stakeholders involved in this data sharing journey.
Yeah, sorry about that, Brandon. Didn't mean to interrupt you. I clicked the slide a little too fast, but let's get to our first question for overall question for the panel. So, in listening to all your introductions, each of you have spent some time in government. We're not all as secretive as Mike, so we can't talk too much on CIA, but some good stuff in government. So we've seen firsthand some of the challenges in creating a data-driven culture. Talk to us a little bit about that experience and any particular hurdles you had to overcome. Matthew, we'll start with you again.
Yeah. Thanks, John. In government and healthcare, we just need data. That's really what some of my experiences go back to. I think back, thinking back on some of my experiences, three things I think come first to mind. It's finding the data, buying the data, and accessing the data. On finding the data, I remember a few project owners. Normally within the federal side, it's like those at the GS 14, 15 level. Within states, it's like that mid to senior career leaders within the organizations. And the main challenge that they were trying to find is trying to find data, whether it's internal sources or external sources that can help solve their problem. But the things that they had come to and told me and working with them is that the data had to be accurate, had to be complete, had to be reliable, relevant, and timely. And when you're dealing with crisis type operations, or you're dealing with perhaps even enterprise, it's not always easy just to find the data that you need. Then moving over to folks, that are responsible for the acquisition, the contracting, and really buying the data. I remember back to several acquisition professionals. I remember a few experiences to where they had to look at their on-hand contracts. They had to determine some of the funding that was on those contracts on hand and whether or not they could even use them. And then T's and C's came up. That's a big topic. And what I really saw them was just like a musician trying to create harmony between the T's and C's of the data providers, the SaaS that they had on hand or that they were procuring, the platforms, whether that's from the cloud infrastructure all the way up to some other platforms. And then after they had figured out and harmonized the T's and C's, they were then dealing with policy owners, which is very important. And then trying to then tie that with the use cases and then user requirements. So they had no easy job. On the accessing data, thinking more to our data scientists, our policy specialists that had to deal with data access, what they were trying to do is just be, keeping up with the speed of relevance, and what we saw generally is it broke down, I think, between two areas. It was on the bureaucratic side and also on the technical side. The technical staff had no easy job. When they did get access to the data, whether it was found or whenever it was bought, then they were trying to ensure that it was in the same syntax, the same format, and 1,000 other technical challenges. And, with it, they then had to deal with replication or processing or movement or ensuring that the data pipelines were maintained. And on the policy side, again, they had just as hard a problem as the technical folks did. And what I routinely found, and I remember this quite often, is the data sharing agreements. And then after working through the data sharing agreements in a bureaucratic process, it was access for use and access for and ensuring that everyone had the right access. And this normally fell not only within the CISOs, but also they had to work with a cross-functional team. So I don't want this to seem too daunting, but again, what I think back to is with these experiences is That is no way to run a railroad. That's no way to run an enterprise, and that's not providing need. It's not providing the needs forward for the patients. So in terms of a compelling reason to change, I saw it because I saw it in the faces of the folks that were dealing with this every day.
Thanks, Matthew. Appreciate that. And to the audience and our panelists, I apologize. I thought my screen was sharing, but it wasn't. So it should be sharing now. If not, somebody just let me know. But Mike, tell us a little about some of the challenges you experienced in data sharing in government.
Sure, and I'll start with the CIA, and you're right, it's not as applicable, but I'll make my way into the state and federal health issues. But I like to pick up the point when Matthew was talking about data sharing agreements, and when agencies try to work with each other within the government. Now I was primarily in the federal government space, to be fair, but there's different laws, different regulations, different legislation, different rules and policies. And literally these data sharing agreements can take months and perhaps even years because you're cross-mixing different laws and legislations that have been, the National Security Act 1947 is what governed the CIA. That's what our lawyers managed with. And we were exchanging information with other intelligence communities. They had different legislation they had to follow. So the complexity, one size didn't fit all in trying to solve a data sharing agreement. And now as part of with Innovacer, what I find also, I've been here 4 years and we have 71 clients now running, production, data platforms on top of Snowflake. And what we're seeing is these different customers, and during the CMS 9115 requirement for payers, we have 7 different payers that have adopted the patient access messaging APIs for their customers. The interpretation by state and by customers varied for every single one of them. So as a developer, we had to build configurability and customization because of different interpretations of the privacy laws in each of those states, or for that matter, even the way HIPAA describes how we have to protect data. And that creates complexity for us in the ability to create a solution that solves multiple problems, as opposed to having to build a problem for each one. And I will say the other part that's kind of, which complicates the data sharing business is most systems, in my opinion, and from what I've seen and looking at, talking to healthcare spaces, is that the data governance practices in most government agencies, and I would say most health systems and payers, have really not evolved to the point where you can fully take advantage of these data environments, whether it's a large data sharing environment, on Snowflake, but being able to track the lineage of that and what the rules are in that distribution of that data, how much of it can be offshore, how much it has to be onshore. The interpretation of those rules vary greatly by state, by company, and certainly the HIPAA requirements. So to me, those are kind of the 2 big things: is the need to kind of create common legislation and common interpretation of that legislation, and then how do we do the lineage on that data to be able to treat it with the privacy required for patients and physicians.
Great. Brandon, any last comments on creating a data-driven culture there and some of those challenges?
Yeah, man, great points. But the word that really stuck out to me is culture. I think it's an important one, particularly when it comes to the public sector, because I think in some ways public servants get a bad rap. I think that there's this belief that workers are really just kind of stuck in their ways, or that they're fearful of technology overtaking human decision making. And there's definitely some of that, but in some ways it can be a lazy excuse. Culture is something that takes a long time to change, but I think it's also incumbent upon the entity pushing the change to have the burden of proof, to show that it's worthwhile. Workers in the public sector are often stuck in their ways because those ways have worked. So I think we have to prove that a new way works better. And I don't think that we've done necessarily a great job of proving the case. So, things like data quality has been a long-standing concern. So state users don't necessarily know that they can trust the results they're seeing. transparency has been an issue. So they're not sure what assumptions are being made or how a given output was calculated. And technology vendor enablement really hasn't been up to snuff. So state workers especially don't know how to use the data or the systems that we're giving them. Fortunately, I think the companies represented on this call, right, Snowflake and Innovaccer, we're doing the hard work of prioritizing data quality, of emphasizing glass box solutions and models, of investing in things like organizational change management and human-centered design. And when those barriers come down, then I think it's much easier to promote a data-driven culture. And once a data-driven culture gets established, once the business use cases of data sharing get built, then I think it's a lot easier to build that momentum to tackle the really hard stuff like, a data governance structure and data use agreements that, Mike was talking about.
Great. Thank you. So before I throw the next question out there for the panel, we do have one question that came up in live. It says, data seems to be worth more than gold. Why? Anybody want to take a stab at answering that, or you can answer it as you go throughout some of these questions, but I'll keep that in the back of your head. Next topic is there's a lot of momentum among governments, in particular health and human services agencies, to be better about sharing data, both within and among the various departments, because it's that gold, right? How can technology help to accelerate this trend? So, Matt, we'll start with you again, and then we'll switch it up next time and maybe start with somebody else. But go ahead, Matthew.
Yeah, I'd like to address the question that the audience member had first, though. Whoever said that out there, they're spot on. Exactly. That's another global trend that I'm seeing. And in particular, what we're starting to see is built into certain strategies in the government side, such as Australia, is built into many of their strategies. And what they highlight is that data is an asset. And, and John, I'll get to the question, but I think this is very important, because what we're seeing in particular is that now that data is an asset, and you think about what an asset is, it is no longer a cost center within an organization. And what I'm seeing is that legacy or parts of an organization that had data, and in many cases, people viewed it as a liability, in particular because of cybersecurity risk. They're now determining that, wow, I have something of value and I can actually make a profit with it or provide additional value to it. And that's huge. It's a huge sea change. And in terms of cybersecurity, there's a reason why hackers and malaligned actors, when they get into the network, what do they seek? They seek the data, right? And I think that right there is what we're seeing, is because it's so valuable. But on data sharing and some of those themes that you're highlighting, you're absolutely right. Data sharing is no longer a nice to do, it's a must do. And we're seeing it for many reasons: business models, patient and citizen expectations, like I mentioned, and efficiency. And we're seeing this also at the federal level. So within the government, a few years ago, there was the CMS's Blue Button program. And I don't know if everyone here is familiar with it, but just real quick on that, it's a federal national program that from CMS, where they were focused on the developers and the organizations to ensure that everyone get Medicare claims data via API. It was championed with CMS, with the U.S. Digital Service at the time, and it really aimed on something very important as a patient, as a citizen. And what they were trying to do was cut down on the time that a patient had to explain to every single person within the health system, the same data over and over and over again. And I think that's what we want to see as citizens. I think that's what we want to see as a patient, right? At Snowflake, what we're seeing is two things as it relates to this. First, entities that begin to share data almost never ever stop sharing data once they start. As it relates to that, we have a picture I think will come up later. But what we're seeing as it shows that is when they start sharing, again, the value is seen, again, back to the point of data being an asset, and you start to see the value of it. Second is that data sharing, and this might be a bit counterintuitive, but it's actually a catalyst for better cybersecurity, better business models, better policies, better support services, and hygiene. And I think that's really unique. In a bit, I think I'll talk a little bit about what makes us unique in terms of data sharing compared to others. But John, I think that's some of the key points. And again, whoever in the audience pointed that out, spot on, exactly right.
Yeah, appreciate that, Matthew. Brandon, any topics, any points you want to make around data sharing and how technology can help?
Yeah, I think some of it comes back to the last discussion we just had, right? The technology is critical, but it's not purely a technology challenge. There's there's other ingredients that have to get baked into this data sharing cake that we make. We talked about last time's processes, right? Things like establishing a data governance council among stakeholders, building out those data sharing agreements is important. So too are the people, though. And I just don't mean the people working with the data. They certainly have to buy into the need to share the data. They've got to be willing to sort of loosen their grip on the data assets. But the other people here are the citizens being served. Those are the business stories behind the technology investments. And we really have to be able to tell their story to show how the lives of, in this case, a Medicaid beneficiary is being made better. And I think that comes back to the point that Matthew just made, right? There is inertia in data sharing, or to kind of switch physics terms, there's data has gravity. So large data sets tend to attract smaller data sets, and that diversity of data available enables us to solve larger and more complex challenges. And I think that's where whole person care starts to come into the picture, because it's arguably one of the most challenging healthcare concepts, at least from a data perspective, that we could wrap our arms around. And so I think it takes a lot of technology advancements, things like FHIR APIs to promote interoperability beyond traditional methods of data sharing like SFTP. I think standardization practices, so things like the Gravity Project, which are really helping to create these definitions for social determinants of health, to standardize our ability to speak the same language and communicate effectively, is really important. And then I know Matthew just alluded to it, and I don't want to steal thunder, but I think Snowflake has some awesome technology capabilities here as well that I think will help to facilitate data sharing when it comes to whole person care.
Mike, any comments on that question, or data being worth gold before we go to the next question?
So I actually think, an investment in data is probably a little bit better than gold these days. I mean, if you look at, the 71 clients we have over 54 million lives under management that we're stewarding the data for our 71 clients. As part of the value engineering group, and then we have got established returns in the hundreds of millions of dollars, whether it's increased payments because of improved quality scores, managing risk better as part of some of the risk-bearing entities that we work with, but having the data to be able to operationalize efficiencies and better manage and treat the members or the patients within these health systems has massive returns that come back, and we're seeing these firsthand with the folks we're using, and a lot of it wasn't available even as short as 5 years ago, because you couldn't tie together the claims data, the clinical data, to be able to get that whole person view, which is what we're talking about that particular person that we want to improve their outcomes for. So I think it's and it's evolving too, because I don't think everybody actually appreciates that comment about, is it really worth the goal? Because if you can improve readmission rates, that's money in your pocket. So and I think it's established and it's happening, and it's all happening because of the capabilities that are out there from a data management perspective.
Fantastic. We'll stick with you for the kick off the next question, Mike. And going back to data sharing, despite the progress that we've had with technology, it still seems like there's a pretty wide gap in understanding the need to share the data and actually taking the steps to share the data, right? Maybe it's because it's worth all that gold. Nobody wants to share it. But do you think that's true? And what are some of the remaining hurdles we need to overcome to make data sharing a reality?
Yeah, so I do think it's true. I think there's a lot of frustration in getting funding for data-driven products. Having worked at a large healthcare system for 6 years, it is very complex to understand what really goes on in that data sharing piece. We used to, at Kaiser Permanente, we had 1,800 apps. All of that data, all those apps had to talk to each other. Not everyone had to talk to them, but there was a huge interoperability function within my department, in fact, that had to be passing data between those different applications to, and inform those types of capabilities to meet numerous use cases. And in many cases, we were our own worst enemy, because it's hard to explain all the data movement that goes on at night. the batch jobs that don't get run, don't finish by 5 in the morning when business starts. It's hard to articulate that to the financial people who are trying to find that magical ROI. And so why I think what I just mentioned too, we're starting to see, based on history, some breakthroughs in some of this, like improvements, in, like I mentioned, readmission rates, improvements in, quality scores out of these environments. So I think as more and more of these use cases get made public and believable, I think the better we can start making cases to the financial community. But I think one of the biggest hurdles is when you go into that CFO and say you need, what probably is a significant amount of money, although it's getting less nowadays since we're taking advantage of the cloud and subscription-based services. I don't have to buy 60 servers any longer. I can rent them. But I think as we go forward is trying to manage that complexity of the business use case around data sharing is quite complex. And again, I think we're seeing progress in this, but it's tough.
Got it. Matthew, any comments on that one?
Those are good points, Mike. And I don't know when you were in leadership over there, but I think it's been about 5 years ago, the Healthcare Financial Management Group put out a study or an overview report on about 70, I believe, was the number of executives in hospital systems. They said that data sharing was essential to delivering, that value-based care that everyone was talking about back then. And, what was interesting is that as that metric came up, because that stood with me, then the same executive said, well, despite that, only about 25% or a quarter of them found that the organizations were then able to share internally and externally. And I think that starts to create some contrast, right? So what that told me then is there's some definite work to do. And, as we talk, as I mentioned earlier, that it's probably about time we revisit some technology assumptions. I think it's probably true now, based on what you said, to also revisit some policy concepts that are, I think, hampering this. And, when Brandon talked about, culture, it's powerful. It does take some time to move. I don't even know if you can change culture. I think that's probably, an academic question. But what I do know is that one thing you can change are some of these policies, some of these laws. They were never meant to be written in stone. They were meant to be living documents. So whether it's the CFR, specifically 42, HIPAA, or state policies they're starting to, I think a lot of people point to as a reason to not data share. I think, it's probably time that we start to look at it. I know the citizen in me and the patient in me wants it to ensure that the best data is provided to the best person and best process so that you receive the best care. And I think that's really key to achieving what we're talking about in holistic care. Unfortunately, too often, I think these frameworks, again, are used to why it can't occur. And I'm not convinced that's what the authors of those policies and laws, set out to do when they wrote it, right? I don't think they said, in a few years, I hope it stops holistic care. I don't think it is. But again, I think it dissuades a whole lot of action. We had alluded to what we're doing at Snowflake, and I just want to highlight, quickly as our point of view on this. Our unique design is ensuring that we're able to, facilitate secure data sharing. And truly, I think that's making some material change, not only for the folks here, but, all of the industries and all the public sector. What we're not relying on is on those archaic methods of data sharing. And what this new design is allowing the data sharing to occur by moving the compute to where the data resides, as opposed to moving the data, into Brandon's point, because it has mass all over the place. And I think that's clearly a game changer. And if there's any cybersecurity folks in the audience, if you're not moving data a whole lot and not replicating it all over the place, it's more secure because it sits where it lies. In addition to just making it more secure, it's also improving performance. It allows you to hit the canonical data source, let it be queried, let it be used, without fear of, is it the right data set? Again, to the points I had highlighted earlier, you don't worry, because again, it is the canonical data set. And I think that's really important. And I think it's in particularly important for holistic care and for the patient view. Often within the states, what we're finding is that the patients, and the insights that are generated are sometimes not those that are the most up to date. And what's key area of whether it's holistic care or social determinants of healthcare, or even just tying it to financial insurance coverage, right? You need the most up-to-date data accessed in a very quick machine speed way.
Great. So we're going to have a quick survey question. Hopefully it'll pop up on your screen. Which are the top 3 challenges that you face while adopting data sharing technologies for your organization? So we'll give it a minute or so while our audience answers that question. Any thoughts on this from the panelists on the top 3 challenges that you've faced while adopting these sharing technologies? All of the above should probably be one.
I think we certainly talked about every single one of these, so I'm quite interested which one wins as far as, has the highest priority, but because we did mention funding and budget constraints and be able to articulate that ROI. Certainly, Brandon talked about the cultural resistance, and I think early on we were talking about kind of the data governance in the government spaces, are not as mature as perhaps in other industries. So
Yeah,
it'll be
for sure.
interesting to see who wins. Yeah.
All right. Yeah. All right. We'll keep that poll open for a little while longer, and then when we get the results, we'll pop those up unless we can see that they're back yet. All right. When they're back up, we'll bring those up. From the next question perspective, terms like data sharing, it also implies movement, as you were talking about, I think, Matthew. And for that, we're using things like FTP, or if agencies are advanced APIs, and we talk about FHIR APIs, and what are some of the considerations that Health and Human Service agencies should think through? Matthew?
Yeah, thanks, Sean. And I see you just put the data cloud and the evolution that we're seeing here up on the screen. So perhaps what I'll do is just highlight what everyone's seeing there. So Brandon had highlighted that COVID was, an event of our time that spurred on a lot of change. And we saw the same thing back at the start of COVID. And in terms of data sharing, it was an event to where data needed to go where it needed to go quickly, so that we could, as a country, as a world, respond quickly. And what you see on there is the start of what we started to see. What we started to see was, and in this case, a data set that is related to COVID and Johns Hopkins, is the data sharing relationship. Each of those dots on there shows a Snowflake account of a certain size, and then the connection in which they're sharing with other organizations. As we, at Snowflake, we call that a stable edge, because again, once that starts, we almost never see it stop. And again, I think that gets into the audience's comment on data being valuable. What's also unique as it relates to it, because of this new sharing technique, is now that, as we mentioned, the way we're doing is a bit more secure. But one thing I pointed to earlier was this API out of CMS, and we're starting to see within public sector and some of the domain experts understanding what that means. But one thing that I'm starting to see right at the start is that there's a limitation to APIs, and while it does allow folks to access the data, one thing that it doesn't provide is the telemetry, the data telemetry to those who are putting it out. So, for example, I get questions all the time from government leaders of, "Hey, Matt, can you tell me who's using my data?" And I say, "Absolutely, I can. It's a few folks." And they say, "Well, what do you mean?" I'm saying most of them are bringing into Snowflake and through your API, and then it's going out to the world. And they're saying, okay, well, how do I figure out what I need to know? Because I'm either I'm trying to determine, how useful it is. I want to determine what syntax, what periodicity, what the value. I have to do a budget supporting document. And what I explained to them is again, what we're seeing is in terms of telemetry. And I think this is where things are going, kind of an insider's peek into, where the listing's going, how many jobs are being run of it, what products are they using, at what granularity and access controls for what time. And I think, that's something we're starting to see as it relates to data sharing and to really understanding where your data is going.
Fantastic. Thank you, Matthew. We do have the results from our poll. Can everybody see those? Great. So any thoughts on this? It's pretty even across the board. Again, Mike, you mentioned that we've talked about a lot of these, and I think everybody's kind of saying, yeah, right. They're all challenges. So good. Okay.
So one thing I'll add on what Matthew was just talking about, and so kind of beyond these, on kind of the positive side is, it wasn't even 5 years ago that we were handling the big data problem by replicating it. I mean, the idea was send the data, and move it fast, trying to keep it in sync, and and which just complicated matters, because really seriously, we were pumping data. I think at Kaiser Permanente, we had one application. It was a cloud-based app, so but we had 100 interfaces, and the interfaces were send them data, they would send it back, and we'd send it back, and it was really, it is what we had to do at the time to get the performance, to get the volume of data that we needed. But now with what Snowflake has provided us as capabilities, what the cloud providers have given us in getting the server together. I know it would take me 8 to 9 months to get a server configured. I can get one in 8 minutes now. And so the ability to rapidly, and I think it really has been in the last 5 years, is that based on these tools that we now have, and certainly part of Innovacer, is we can very rapidly build out these environments, which would take, in the past, would take years to build out. Whether you were using an Exadata environment, or you're configuring 60 data servers, or whatever it may be, we can really super rapidly respond to these today. And now the bigger issue is, how do you move these legacy environments that are working, they get the job done, expensive to run, but how do we get that movement to take advantage of these great capabilities, which, and I'll go to where Brandon talked about, data gravity. It's exactly what gravity does. Gravity attracts more and more data. And as more and more data is put in a single storage space, the better insights we can generate. And that's what we've taken advantage of, the tools that we have at Innovacer, is we generate those analytics to help find those optimal customer and risk-bearing type capabilities. So, the good news is we can move fast on this as we start clearing out what we've built over the past decade or so.
Great. Thanks, Mike. So you have another survey question that'll pop up on your screen. How would you describe the data sharing practices at your organization on a scale of 1 to 5, 5 being the highest? So explorers, builders, implementers, transformers, leaders. Gentlemen, any thoughts on, I'm sure you've seen all of these in your experiences. Any comments or thoughts on this question? Where have you seen in your background? Builders, transformers, any concentration?
Well, I think John, you may have all of them in the same organization at once, right? And that gets into some of the maturity models that have been created around this. But as an enterprise leader, especially for those who are dealing with statewide organizations, right? You probably have some folks that are leaning forward and perhaps doing some interesting pilots, near the cutting edge. And then meanwhile, you have some other parts of the organization are probably more towards that number 3, or maybe that number 2.
Yeah, good. I know we have pretty quick results, but if we have the results, let's pop those up. All right, here we go. We can see that, implementers implementing the pilot project seems to be the highest with 71%, and pretty even between explorers and builders. Yeah,
and I think that's a pretty important place to be. I think pilot projects are, just awesome opportunities to show value quickly, and that can be, I think, one of the chief impediments to big concepts like data sharing, especially around whole person care. It is a large and amorphous and complex problem that you shouldn't dare solve all at once. So, jump in there with a pilot project, show value, prove that you can get some near-term results. And I think that can take you to the transformer and leader, statuses fairly quickly.
good comment. Okay. With our next question, it seems like one of the things driving the need to share data is a shift towards whole person care. What are some of the policy shifts this group is seeing that can help push the business case for data sharing? And Brandon, we haven't started with you yet, so let's start with you on this one.
Yeah, I think it's a good question. I mean, to me, the biggest shift right now is that we're moving away from this idea that whole person care is revolutionary, and I don't say that to denigrate the idea of whole person care. Rather, I think it's awesome progress that now whole person care is part of our everyday discussion about how care should be delivered, rather than this like new and novel and cutting edge thing. I think a huge part of that shift towards whole person care being normalized is moving away from the pretty picture of what whole person care could be to the nitty gritty realities of what it is. You know, for instance, it's one thing to recognize that installing a new carpet may reduce a person's ED usage from asthma. It's a great story. It helps to show a clear link between social investment and health outcome. But it's a whole nother thing to think about a way to pay for that service in a way that then incentivizes a managed care organization to provide it. And that just means not building it into their MLR, but also their capitation calculation. And that's where a lot of policy groundwork has to be laid. I think of North Carolina as a great example. They did the hard work of building service definitions for these services. Things like housing move-in support and food boxes and public transportation reimbursement. These are things that now have a fee schedule attached so that they can be reimbursed just like any other healthcare service. That's hard work. And in many ways, it's really ugly work. But it's what it takes to make this a reality, right? And we've got a lot of other states who I think are making similar progress. You have California with their CalAIM demonstration, which is funding community support services. You've got Oregon's waiver, which is pumping in more than $1 billion into health-related social needs. And shout out to one of Innovator's strategic advisors, Jamie Snyder, who really spearheaded this in Arizona with the Housing and Healthy Opportunities Program, which is using housing services for individuals at risk of homelessness. So, each of these states, each of the leaders in those states is doing the work that's necessary to actually define what whole person care is. And I think that that's really necessary to make it real, to move beyond storytelling to actively doing. And I think all of that is built on this concept of being able to share data between all the stakeholders involved.
Great. Thanks, Brandon. Matthew, any comments?
John, it just came to me, and as I'm looking at that picture there and Brandon's comments, I think the most important person on there is a patient, right? And I know I'll come back around to policy in a second, but that's what's front of mind to me, right? It's the biggest case, whether it's a business case or just a case for change, is certainly that person's expectations right there. I recently went to the doctor, and when I went in there, right, I knew my situation. I knew everything as it related to why I went, why I chose the place I did, the provider that I saw, the nurses that helped me after the fact when they called me for a follow-up, how I got my medication, my insurance, right? I had all that in hand. And when I think about holistic care, right, that's a lot of unique data that I know myself, or perhaps if I wasn't able to, right, and someone was helping me with my family unit, they would have to bring it all around to provide an all-around holistic experience for me. As it relates to technology, though, and policy, certainly, it wasn't front of mind when I was just trying to seek care. But now that I think about it, security and privacy needs to be wrapped around all of that experience. And, what I think about the ecosystem, and it's not just in healthcare, retail, insurance, finance, and others, right? That's kind of a basic expectation to not only the technology solutions, but the overall experience. And I know I had started this talking about the CFOs making a lot of these decisions and cost-based decisions, performance-based decisions, but certainly it's that patient there that in their expectations that are really driving this. But onto policy, right? I think back recently, in the US, we have our first national cybersecurity strategy, and it really mandated, key cybersecurity functions for critical functions within American healthcare is certainly one of them. And it just, if you haven't seen it, if you haven't read it, I strongly recommend everyone do so, because I can't go a day without seeing something in the news as it relates to ransomware or something to that effect as it relates to the healthcare industry. So in order to not only provide holistic care, but, and regardless of where you're at within this system, healthcare institutions certainly need to ensure that they're providing secure platforms that are ready to meet the challenges that are affecting not only the patient but the institutions that are providing it today.
Yeah, I like your bringing up the patient as the center right there. It's something that One of my counterparts, Gary Druckenmiller, who runs our CRM business, always says that the patient, the citizen, right, the constituent, it's got to be the center of everything. So great points there. We're running a little behind. We said we have a couple of questions in the Q&A, so we'll ask our panelists to take a look at those. But Brandon, maybe briefly can touch on our question number 6, which is behavioral health and substance abuse treatment. They're obviously big parts of and critical parts of whole person care. There's also a lot of challenges with that around data sharing and the privacy acts and whatnot. So how do you balance that, right, between the balance of the integrate the data and the need to maintain that privacy?
Yeah, it's a good question. And I'll start out by saying that I think that the bent towards privacy is justified, right? It's going to sound silly to say it, but the key to effectively treating things like substance use disorder is treating them. So if individuals aren't going to get the treatment because they're worried about, things like a loss of employment or housing or child custody from having someone learn that they have a substance use disorder, that is a very real barrier to care. Fortunately, I think we're making progress in reducing that stigma, but we're just not there yet. And until we are, we really have to keep privacy top of mind, which is why I think things like the secure data sharing, that we've talked about and that Snowflake allows for is really important. But we do have to balance that need for privacy with the need to practicably ensure and share data. So for instance, people with substance use disorders are at enormous risk of chronic conditions. The coexistence of mental illness and substance use disorders is very common, particularly in Medicaid. And both of those things have tremendous impact, not just on Medicaid budgets, but more importantly, on individuals who are struggling to survive, much less thrive, because of these co-occurring mental, behavioral, and substance use disorders. So we really have to balance that risk of privacy with also the risk that without proper and comprehensive treatment, that health outcomes are just going to remain poor. And so I think, we as technologists have come a long way towards striking this balance. So that includes things like being able to set role and row level security to ensure that folks only can see the data that they need to see. I think it's being able to manage ontologies through the comprehensive data governance and create value sets for sensitive codes, so we know how to effectively restrict access. And then Snowflake, they have an awesome capability that we leverage called tag-based masking, which allows us to mask data, obfuscate the results of that data, but also retain its analytical value so that we can make big population health decisions without necessarily revealing the identity of any given patient. And so I guess the main takeaway through that sort of rambling approach is that this balance is really hard work, but that's different from impossible work. So we as vendors really need to work to identify the technologies with our customers that balance those two competing priorities.
Yeah. And really briefly, Brandon, you just made me think about something. It strikes me as, and I thought I shut my phone. It strikes me that governments aren't the only one who obviously need the data, right, to promote whole person care. How can government work to empower other stakeholders, managed care organizations, provider organizations, with actionable data? And that should be brief because we do have a couple of questions I want to make sure we get to.
Yeah, I'll be brief, and I think it actually ties into one of the questions, so maybe I can give you a good segue. But I think what we're talking about is that traditionally government agencies have been one-way streets of data. That providers and payers send data to the states, but states have not always had the best way to get it out. And so I think we're working to change within agencies to agencies data sharing. But now I think that the next horizon and where we'll really be able to reap benefits of data sharing is looking outside of those four walls of government to begin sharing data with those other stakeholders as well. And so, one of the things Mike talked about earlier is the patient access and interoperability rules, which is giving us sort of that first taste of how to make data available for patients and providers to change behavior. Now, I think it's incumbent upon us to create experiences that don't just serve up APIs, but create that reason for change. And I think getting to the question, it's driving towards that last mile approach of making it easy and within a workflow of a provider or within the lifestyle of a patient or within sort of the business practices of a payer to take that data and be able to run with it. But Mike, I'm sure you have some thoughts there as well.
Yeah, well, and I think you did a good job, Brandon, talking about that. So certainly direct patient access, the FHIR capabilities are enhancing that. You know, getting into the CRM systems, loading the data that comes out of our environment, Snowflake's environment. Those are all positive things to get into direct patient access. And then the other thing I think really, and this is just evolving, I'd say within the last 9 months, the maturity of the EMRs to take data back. And for example, at Innovacer, we're building messaging into the EMR. So if there's a care gap that we want to get closed, we all know the physicians use the EMR as their console. The data's got to get in that EMR. So the write back capabilities, particularly on the you know, the well-known EMRs, the popular ones, but they're all moving this way that we can get that data into the EMR itself. We can get things like our chief medical officer likes to call it the ways for the EMR, and get the information in front of the clinician, whether it's a doctor or a nurse or a caregiver, of what's the next best action for the patient to improve their outcome. And so you gotta, that last mile, portals have never worked. I mean, physicians are very, very busy people. It's gotta get to, you know, in their workflow, like Brandon mentioned. So the EMRs are very accepting now, the FHIR messaging with full documentation. You can go in and it does a great job. And then as well as the shamelessly plug Innovacer, we have a little slide out that goes on top of any EMR that pops up and says, here's what ought to happen next with this particular patient. It's what our recommendation is. You can ignore it if you like, but it also, you can execute out of that. But I think the question is really, I mean, data is great, but if you can't get it operationalized, then it just becomes an interesting, you know, white paper to talk at a conference. So, but I think there's many methods getting it to, you know, the point of execution now.
Fantastic. We're going to we're going to wrap it up here a little bit. We got about 4 minutes left. There's one or two other questions here that I want to make sure we ask, and this one kind of goes with that last mile. You know, the whole person care ecosystem, community benefit organizations, food pantries, churches, et cetera. They don't really have these, you know, IT systems. So how do we get to them, right? How is this helping them? I'll take a shot at that.
So I would say a lot of them. So, you know, I think, you know, oh boy, Aunt Bertha, which has a new name, which I can't remember right now, but it's a old day. Yeah, Find Help and Unite Us. You know, those are two tools that we work with, both of them. And so they have been doing a good job of getting into those communities and those environments. And so that's progressing, and certainly a partnership with them is important. But also what we've seen, we have some clients in certain geographies where they have taken step forwards because the community leaders want to solve this problem as well. And we do see advancements in you know, the food banks, you know, the justice system in some of these places are getting better and better capabilities to share data and work both ways. To Brandon's earlier point, is it's got to be a two-way street for this to be most effective. And actually, when you start getting in and creating these capabilities, there's a lot of services are out there and available to people if we can just get in touch with them. So, but it's the question was right. It's slow in coming, but that's kind of the best answer I have on it.
So there's other questions we'll get to if we haven't answered them. And in here, I just want to give the panelists we got 2 minutes left. I want to give each one of you a minute to say if there's, you know, one thing that you want this audience to walk away from this conversation. What would it be? Matthew, we'll start with you.
Yeah, thanks so much, John, and really appreciate that last question. I think what it highlights is the fact that there are several other organizations, several other dependent systems that need to be data connected, right? And that's really what it's getting to. And if it's not just those organizations, food banks and the like, it's other things. One thing that's really coming front of mind, especially with my travels up north, is the value of data. And what we're starting to see in a continuing growing is the data marketplace. Snowflake is allowing those who have data, who are working with us, to make it available to others. Some of that is through paid arrangements. Most of it is not. and it's just available. And there's quite a bit of free data on there as it relates to government data sets and can get used to today. So that's one thing I want to highlight to everybody here is if you haven't taken a look of the data that's available today, please do off of the data marketplace.
Great. Mike, any last comments briefly?
Yeah, I just had to, I mean, the tooling's available, the systems are out there. People, there's great outcomes happening as this develops. You know, it's kind of a challenge to our industry is how do we make sure that it makes sense to invest in these? And, you know, kind of the excuses are gone in my mind. The security's taken care of, the volume, the speed, all those are managed. It's how do we make sure and, you know, convey the fact that, like the earlier question, data really is gold to an enterprise and it's going to have payback.
Great. We're at the top of the hour. Brandon, anything real quick?
Real quick, I just don't let perfect be the enemy of the good in this case, particularly when it comes to talking about sharing with things like community benefit organizations. You know, these are going to be lots of non-standardized data sources. Progress is going to be slow. Work with and partner with vendors who can start small and deliver and help you really achieve the value out of this really big and complex challenge that is whole person care.
Great. With that, I'll wrap it up. I know we're a little bit over time. If you didn't get a chance to ask your question, please email us at team@innovaccer.com and we will certainly reply. Thank you for the panelists and thank you for your attention. Goodbye.
Thank you.
Thanks, everybody.